Why do you drive an hour to come to see us? Why did you pick us?
I saw good reviews, and also you were able to get me in the same day. I called several places, and they couldn't get me in the same day.
Was the staff friendly when they were?
Oh, absolutely. The staff was very friendly.
Good morning, Baltimore. I have Kathy with me this morning, and Kathy came in yesterday, right?
Yes.
And Kathy, what brought you in?
Severe back pain.
Mm-hmm.
I've had issues with my back most of my life, and I could barely walk, sit, just in excruciating pain.
Most recently. But your back pain goes back, your history goes back what?
1988.
And you had some sort of discectomy back then?
Yes.
So she's had low back surgery, and then you had some sort of traumatic event that happened to you around 2014.
Yes.
And the neurosurgeon recommended surgery at that point?
Yes, he recommended
What did he want to do? Fusion, right, okay. All right, and so a month ago you were okay.
Yeah.
A week ago what happened?
I turned the wrong way, and that was it. I could barely move, and I'm in a lot of pain because of it.
You got a flat tire?
Yeah, flat tire.
So were you in bed when you turned, or were you standing when you turned?
No, I was standing.
You were standing. Mm-hmm. In which direction did you turn in?
I was kind of bent down a little bit, and I turned to the right, and that was it.
So you were flexed forward a little bit like this?
Yes.
Yeah, okay. And which side's most of your pain on, the left side or the right side?
Most of my pain is on the right side.
Yeah. And so this is Kathy's second visit. We saw her yesterday. And when you came in yesterday, your pain was on a scale of 0 to 10, 0 no pain, 2, 3 mild.
I would say probably a 10.
A 10, yes. And then by the time you left yesterday, what was it like?
I would say the pain was still there, but it wasn't quite as excruciating. Like I felt that I could move just a little bit better.
Yes. And you couldn't. Remember how we were having you bend to the right and to the left, and you couldn't even get over to the left. Yes.
The shocking pain.
So let's start by getting this. Let's see you bend to the right for me. Laterally bend to the right for me. Where's that grab?
It's in the center and down the right.
Down the right. Mm-hmm. Now let's have you come back over to this side for me. Yeah, so you couldn't do that yesterday. At least you can get into it. When you bend to the left, where's the body?
It's the center to the right.
Center to the right, okay. Now let me see you try to arch backwards like this a little bit for me. That's still pretty uncomfortable, isn't it? Yeah. Now let me see you try to go forward a little bit for me. Just go the best you can for right now. Just get a baseline.
That's okay.
That's all we need to do, okay? So what we did with Kathy yesterday is we put her through a series of Mackenzie flexion exercises while she was lying on her back, knees to the chest or armpits, and then we put her on a chair, and that seemed to give you some relief, right?
Yes.
So what we're going to do is we'll show you a few of those. Do you feel comfortable enough to do them sitting, or would you rather start lying on your back and then gradually working your way to sitting? What do you feel like you're up for?
I'm going to try the sitting.
Sitting, okay, all right. So let's come on over here. And I'll let you have a seat right here. And we're going to
Facing this way.
face that way, be fine.
You should subscribe.
And then while you're down there, breathe in and get that air into your belly. That'll help bring you back up again, okay? And then you breathe out on the way down. Breathe in a little bit and then come back up. And as you start to loosen up, you can get deeper into it. You can actually grab the side of your ankles and go forward a little bit. So how long are you going to hold that for? What did they tell you? How did they tell you to do it?
Well, to take 2 deep breaths and then exhale as I'm bringing my knees. But say 4?
That's good. So
4 reps of...
So I want you to let your legs down again. You see this? Just hold them.
Okay.
Bring them back up again. Breathe in. Breathe out as you bring them to your armpits. Bring them all the way in. All the way in. 1001, 1002. Let go and come back down again. I don't want you to hold them like that. 1001, 1002. Breathe out. Bring them towards your chest. When they get up there, we are comfortable. 1001 and 1002. We go back down again. Okay? That's the way we do that. All right?
If you like the video, be sure to like, comment, and subscribe for more.
Okay, we're back with Kathy, and Kathy couldn't tolerate Mackenzie sitting right away. she drove probably 45 minutes to an hour to get here this morning. Is that right?
Yes.
Yeah, which isn't the best position to be in for her. So we had to go to putting her on her back and doing the Mackenzie flexion protocol that way, and then we transitioned to the sitting protocol. Did that help you at all compared to when you first walked in the office?
The laying down did. When I went to do the sitting, like my back wouldn't let me do it without being in a lot of pain.
Pain, yeah.
Yeah.
And so we brought Kathy into one of the adjusting rooms, and we sort of adjusted her off camera just because of the level of discomfort she's in, and it moved really well. Was it please, all the way over? Go as far as you can, Kath. Yeah, how's that feel now compared to before when we started?
It feels a lot better than what it
Yeah.
was when I first started.
And let's try to go back to the left side for me, right? Yeah. And that does what? That's a little sore there.
Yes.
In the middle of your back?
Yes.
Does it cause any pain down your right leg at all when you go to the left?
Nothing's shooting. It's
Okay.
just feeling numbness right
On
now. But
does it increase the sensation of numbness on the right leg when you go to the left?
it does.
It does,
A little
yeah.
bit,
Okay, good, yeah. But how about the left leg right now? Is that okay right now?
It seems to be fine right now.
Yeah.
There-
And this is a good example. Kathy is really acute. She's guarded. She's antalgic, and disc bulges or disc protrusions, internal derangements of the disc, either happen on the medial or they happen lateral, and they present differently. And with Kathy, we've got to go through this routine where we make sure that we're treating the right type of irritation. And in her particular case, it's more of a right central disc irritation, right? And we treat that a very specific way, and we have great results with it, right? And just, now this is your second visit, I can just tell you're so much more comfortable in your face right now compared
Yes.
to when you walked in the door. So what we're going to do is we're going to send her back out onto the dance floor, and I think now we'll be able to tolerate the Mackenzie sitting flexion, right? Okay, so we're going to do that again.
Okay.
And her homework is to do these exercises every hour and a half. If she sits for any prolonged period of time, I want you to do a set of those also, right? Have you been icing at home or putting heat on your back? Neither one.
Neither
So
one.
if I had a preference, it would be ice right now, because I think the ice would help with the pain, the spasm, and the inflammation that's back there, right? So you wouldn't want to use a heating pad, okay? All right? And this morning she did the right things. She got out of bed, she woke up this morning, and she did her knee to the chest exercises before she got out of bed. She got up, and it helped her a little bit, and she went through the sitting progression, and then she drove down again an hour. So that's a battle we're going to have to do. Why do you drive an hour to come to see us? Why'd you pick us?
Well, I work in Baltimore, and it's close and convenient for me. And I saw good reviews, so I came in, and also you were able to get me in the same day.
Right.
I called several places, and they couldn't get me in the same day.
Was the staff friendly when they were?
Oh, absolutely. The staff
Yeah,
was very
that's awesome.
friendly.
So she's going to have a great experience here. So let's go back out, and I want to do those exercises with you sitting again with the staff out there, and then I'll see you before you go.